My name is Timothy McCall. I'm a physician, a medical doctor, and I practiced for a number of years in the Boston area, but gave it up about 25 years ago to pursue yoga and yoga therapy, written books about yoga therapy, taught workshops around the world on yoga therapy. My flagship course is called Yoga as Medicine Level 1, affectionately known as YAM 1, and I invite you to consider joining us for one of these workshops. Now, these workshops are intense, 5-day, 30-hour immersions into yoga therapy. Now, a lot of us have misconceptions. I know that I did when I got into yoga therapy about what yoga therapy is and how it works. We read books and magazine articles that show us sequences of yoga poses that are supposed to be good for various conditions. But this is really not the way that yoga therapy works. We don't prescribe on the basis of the medical condition per se. It influences what we do, but it doesn't dictate what we do. What we do in yoga therapy is do a holistic evaluation on every person we're working with. Now, by holism, I mean the whole, everything, body, mind, spirit, environment, culture, anything that potentially affects health and well-being is part of the holistic evaluation that we teach in this workshop. And I want to say, by the way, that what we teach in YAM 1 goes way beyond what I write about in my book, Yoga as Medicine. Now, that's a good basis for what we're going to learn, but we take you much deeper into this material. In dividing up the holistic landscape, we use a model in our evaluations and in the casework we do in YAM 1 based on an acronym SNAPS. And SNAPS stands for structure, nervous system, and I include under nervous system assessment of the breath because the breath is so intimately tied to the nervous system. Then the A stands for Ayurveda. We learn to assess someone's nature, what kind of imbalances they have, what's the state of their digestive fire, their Agni, do they have any ama, any toxicity in the body, etc. All of which then helps us guide the yoga practice and any dietary and lifestyle suggestions we make. The P in SNAPS stands for psychology. And what we're really looking for here is what are the person's psychological habit patterns? And do these habit patterns serve them? And how might we improve them if they don't serve them? And finally, the second S in SNAPS stands for spirituality. The real foundation of this course is the group casework. Basically, what we do is we take patients from among the attendees of the workshop. We typically pair one patient or client or student, whatever you want to call it. We typically pair the patient with 4 other attendees who work together as a team, doing the holistic evaluation, coming up with a practice for the student that ideally they take home and start to do once they get home. Crucial to the Yoga as Medicine workshop, and really on some level the best part, is the final day when we have the case presentations. Now, each group presents the case. We review the assessment. We review the prescription the group has come up with. I may ask the student to demonstrate if there are poses or breathing practices or other techniques that have been taught to the student or prescribed for the student. I want to see the student do those and make sure that they're really going to serve them well. So essentially what I do is go through each practice that each group comes up with a fine-tooth comb, offering a lot of feedback and tweaking to try to make it be as good as it can be. Now, this is quite an educational experience, particularly if you spent the last couple of days really coming up with this evaluation and prescription for the student, to then get kind of a master class on how can we take what you've done and potentially even make it better. Now, occasionally I throw up my arms and say, hey, you guys did something amazing. There's nothing more I can add. But that's a rarity. Almost always I'll come up with an idea, or other members of the group will come up with an idea. And this is one of the best parts of the workshop, because we come in to these trainings with different expertise. We typically will get healthcare professionals, physicians, nurses, maybe physical therapists, occupational therapists, psychologists, etc. We often get very seasoned yoga teachers. We get people who are yoga therapists. We get people who are hoping to become yoga therapists. We get serious yoga students, and we also get some people who just have arthritis or anxiety or insomnia or some chronic health condition that they're looking to find some relief for, and they're hoping to become one of the patients. Now, we can never guarantee that anyone who attends becomes a patient, because only a handful of people in each workshop will get that opportunity. One thing I'll tell you about this workshop, I've taught it over 50 times over the last more than a decade, is that it's never the same workshop twice. For one thing, I've been able to tweak it based on the feedback from you folks over the years to make the workshop progressively better and better. The other thing that changes is that I, as I hope you are on the lifelong learning plan. Every time I teach it, I've learned some things between the last time I taught it and this time. And sometimes those will end up affecting what I end up teaching or end up observing in the people we work with clinically. The other thing that changes is the cases. And so much of what we do depends on the cases. And since they're always different, we're always learning new things. And I include myself in that category. I learn every time I teach this workshop. One advantage I've found over the years in teaching this workshop based on casework is that it really ended up giving material appropriate for students at every level, whether you're a healthcare professional, whether you're a yoga therapist, whether you're just someone who has a medical condition or looking for help. You'll find that the discussions of the cases, which go into a lot of detail, but they're a lot of detail, not of theory, which can be overwhelming for some students, but rather detail of the person that we're all looking at, and we can see what's happening with. So that ends up working for people at any level, because of course people with different backgrounds will hear the same information on different levels and be able to glean more or less, but everyone will get things that can be useful to them. One thing that may be surprising, because this is a quite intense training, is that a lot of people really find it to be fun. They really enjoy it. They bond with their classmates, particularly the people they work with in the groups. We get to do some practice together. We go in not only to yoga therapy, but we go into our own yoga practice and see if we can make that a little better. So this is really my flagship training. I'm happy to be teaching it in a number of spots around the world in the coming year. And I hope you'll be able to join us for one of these trainings. Take good care. Hope to see you. Namaste.